När man jobbar så vill man känna att man gör nytta och ge att man överlämnar. Så att många upplever det som kanske ett nederlag. Och att känna sig överflödig, det är lite egoistiskt. Jag vill inte känna mig överflödig, de behöver mig inte. Det är lite jobbigt det. Och att det får man jobba sig igenom. Och kanske då se från den andra positiva sidan att i och med att jag överlämnar så har jag ju kanske kunnat göra någonting som har hjälpt dem att gå framåt. Och att de nu kan stå på egna ben.
In the south of Chad, in the middle of the plains, is a village called Andoum. Most of the people here are poor farmers who grow mainly millet, peanuts and cotton. Since 1970, the Swedish mission has had missionaries here. Apart from evangelism and Bible school work, the missionaries have built schools, wells and bridges, and have started a medical project.
Dans notre région, le dispensaire est très important ici, parce qu'à nos alentours, on n'a même pas de centre médical comme ça. Et c'est grâce à ça que nous sauvons nos frères des maladies.
In the 60s, a French missionary started to treat people who were ill under a tree in the middle of the village. With the help of the Swedish missionaries, that simple start has grown to a clinic which also accepts outpatients, but does not have a resident doctor. Its responsibility is the whole area of Andoum, with 20,000 people. Antoine Nessang is a nurse who started working at the clinic in 1984 when he finished his nursing studies. He has had the responsibility for the clinic since 1989. He says that it was when he was a child during a meningitis epidemic, when many people died, that he decided to become a nurse.
Une fois quand ceux de la grande endémie ont répondu, ils étaient venus. Ils arrivent quand même à sauver certains gens qui étaient malades, d'où j'étais parmi ces gens qui ont été atteints de la maladie. Et c'est en ce temps-là que j'ai vu vraiment que c'est une bonne fonction et j'ai pris cette décision d'être infirmier pour soulager ceux qui souffrent à mon tour.
The most usual diseases which are treated at the clinic in Andoum are different parasitical diseases such as malaria and intestinal complaints. Diseases of the lungs such as tuberculosis and pneumonia, and skin diseases such as scab and filariasis are also treated here. There are also many people who suffer from infected sores and burns. The premises consist of a number of consulting rooms, laboratory and an office, and were built in 1977. Apart from the main building, there are several wards for internal patients. There is also a separate building for patients with tuberculosis. PMU Interlife financed the building. From the beginning, the missionaries have had the goal of handing over the clinic wholly to the nationals. Inga-Lill Sjöberg is a midwife and is one of the missionaries who has been here and trained the local staff.
Eftersom vi målmedvetet har jobbat med att få personal som ska kunna ta över, och i och med att de börjar utbildas från och med 76, så har vi sakta försökt då att hitta lösningar för att kunna ta över. Vi visste ju att det tar 5 år först att få en sjukskötare, och sen kan han inte gå in och jobba själv på en gång. Sen de andra också har ju fått ta sin tid och att vi hela tiden har gett dem möjligheter till extra kurser för att känna sig lite säkrare.
The two Swedish nurses who were in Andum planned to return to Sweden in 1989. During the previous year, the plans to hand over were intensified. Since the time that Inga Lill returned to Chad a year later, she has only worked as advisor. The responsibility for the clinic is now completely in the hands of the local Pentecostal church. The staff are employed by the church, which is also responsible for the clinic before the authorities in Chad. The staff have a meeting every day to discuss aspects of the work. Apart from Antoine, who is a nurse, there are 2 assistant nurses, 2 midwives, and an assistant midwife, a laboratory assistant, a receptionist, and a caretaker. There is also a person who works half-time with the administration. Early in the morning, there are a lot of people already waiting here. Each patient must first be registered and pay the consultation fee. At harvest time, there are fewer patients, as everyone has to help in the fields. Antoine examines each patient and decides the necessary treatment. In 1991, 26,000 cases were treated. Many sick people sit outside with their relatives who have come to help prepare the food for them. There is a mother and child health clinic 2 days a week, which is well attended. About 25 women a month give birth here.
Oui, au début, quand je suis venue, il y a moins de femmes qui viennent ici pour accoucher. Toutes les femmes accouchent à la maison et parfois on peut même avoir 6 à 7 accouchements dans le mois. Et avec le temps que j'ai mis ici, je suis allée dans le village expliquer l'accouchement et les leçons d'hygiène, tout ça aux femmes. Maintenant, il y a beaucoup de femmes qui viennent accoucher ici et elles viennent aussi à la consultation prénatale. Et je vois que le nombre, ça augmente plus que les premières et deuxièmes années que je suis venue ici.
During the years the clinic has been here, there have been very positive results. Thanks to inoculations, child diseases and tetanus have been greatly reduced. Also, since the women started coming here for prenatal care, the weight of the newborn babies has increased by an average of 1 kilogram. The staff go out regularly from the clinic to the villages and have what they call a Children's Day. The help of the missionaries is still needed with this and also with the transport there. They teach preventative care to the mothers, and the children are also examined and inoculated.
Mais comme vous, on parle.